If you are considering CAR T therapy, sooner or later you shall come across a scary term on Google: Cytokine Release Syndrome, CRS. And if you have searched it online, you probably read words like high fever, ICU, neurological complications, and suddenly, instead of feeling hopeful about treatment, you feel terrified. As a hematologist, I completely understand that fear. But here is something important I want you to know. Most patients are scared of CRS because they understand the name. Very few patients understand what it actually means. Let's change that. I am Dr. Ganesh Jaishetwar, Senior Consultant Hematologist and Bone Marrow Transplant Specialist. And today, I want to explain CRS in the same way I explain it to my own patients and their families. Let's start with a simple question. Why does CRS happen at all? Remember, when CAR T therapy is designed to do, we take our own immune cells, we train them to recognize cancer, then we send them back into the body to attack those cancer cells. Now imagine thousands and thousands of highly trained soldiers suddenly finding their target. A battle begins, and when that battle happens, immune cells release chemical messengers called as cytokines. These cytokines are not bad. In fact, they're part of how immune system communicates. The problem is that sometimes a large amount is released over a very short period of time. The intense immune activation is what we call cytokine release syndrome. The easiest way to think about CRS is this: it is not the cancer growing, it is not the treatment failing, it is often a sign that immune system has become highly active. What does the patient experience? The most common symptom is fever. Sometimes the fever can be very, very high. Patients may feel tired. They may experience chills, body pains, low blood pressure, fast heart rate. Occasionally, symptoms can become more serious and require intensive monitoring. And this is exactly why CAR T therapy should only be performed in experienced centers with trained teams. Now here is something many people don't realize. The way we manage CRS today is very different from how we used to manage it years ago. Modern hematology has evolved significantly. We understand these side effects far better than we did during the early phases of CAR T therapy. We closely monitor patients, we track vital signs, we perform regular assessments, and when necessary, we use highly targeted medications designed specifically to control excessive inflammation. One of the biggest misconceptions I hear is, doctor, if CRS happens, does that mean something has gone terribly wrong? Not necessarily. Many patients who develop CRS recover completely with appropriate management. The key is early recognition and expert care. This is why choosing the right treatment center matters. CAR T therapy is not simply about receiving an infusion. The expertise of the medical team before, during and after treatment is equally important. Another concern patients have is neurological side effects. Some patients may temporarily experience confusion, difficulty finding words, changes in attention, or other neurological symptoms. Again, these effects are carefully monitored by experienced teams. Most importantly, patients and caregivers are educated about these symptoms, report immediately. The goal is not to create fear. The goal is preparation, because informed patients do better than frightened patients. Now let me tell you what I tell every family sitting across from me. When discussing CAR T therapy, don't focus only on the side effects, also focus on why you are considering the treatment in the first place. For many patients with relapsed or difficult to treat blood cancers, CAR T therapy represents opportunity that was not available a decade. Every powerful treatment has risk. Bone marrow transplant has risk. Chemotherapy has risk. Major surgery has risk. The question is not whether the risk exists. The question is whether the potential benefit justifies the risk for a particular patient. And that decision should always be made after a careful discussion with your treating hematologist. So if you have been reading about CRS online and feeling anxious, take a deep breath. Get information from the relied sources, ask questions, understand facts, and remember that modern hematology teams are trained specifically to recognize and manage these complications. Knowledge reduces fear, understanding creates confidence, and confidence helps patients make better decisions. If you have questions about CAR T therapy, blood cancer treatments, or side effects you have heard from online, leave them in the comments below. I will do my best to answer them in the future videos. Thank you for watching, and I'll see you in the next video.